I love the fade out of the heart there. That's very cute. All right, you remembered me. Thank you for joining me today for the full circle orientation to pregnancy. You should be able to see my host screen in just a moment. They're going to be sharing a presentation, and we are going to go over a lot of things today. So hopefully you have your notes with you so that you can ask me questions in real time so that I can answer them for you. We are going to start with just a couple of housekeeping items first. First, this is confidential, so I will get a list of who was on the call today, but no one else will be able to see who is there. So if you have questions, please don't be shy. Go ahead and ask them. There are no silly questions. I'd rather you ask them now. And I also have some polls hidden throughout here, so please participate so I know that you're still there because I need attention. And finally, if you have to hop off, I know dinner time is coming up. This entire presentation will be available on our YouTube channel afterward for the duration of your pregnancy. So you'll always have what's current for your pregnancy. We take them down after about 6 months. So let me show you how the poll questions go. Who's on the line? And it's also important for you to answer the poll questions because it helps me figure out what directions to choose your own adventure kind of situation. How many first-time moms do I have here, and how many mommy veterans do I have on the line? So that will help me tailor how I read through the information that's coming up. So I'll kind of chat like this a little bit, and then I'll say the polls are closing in 3, 2, 1. You'll answer very quickly, and then I'll say, boom, the polls are over. All right, so this time it looks like the first time moms far outnumber the veteran moms. So we'll get a lot of information as if you're hearing it for the first time. All right, let's start with what we're going to go through today. So we're going to visit the full circle experience, talk about where we deliver, go through some of our office protocols, like the best ways to contact us, what to expect at each of your pregnancy visits. I'm going to give you lots of prenatal resources. We'll go through exercise and nutrition in pregnancy, and we'll wrap up with a quick COVID-19 update. So first, just to give you a little bit of overview about how our practice is structured. We are a collaborative midwifery model practice, which is based on the fact that pregnancy and birth are normal life processes. It's not a disease that you contracted, of which we must cure you, but it's something normal and physiologic, and we're just here to watch and make sure things don't turn left. In the traditional model of midwifery care, they care for normal, low-risk women, and if they identify anyone who has an abnormality, she might not be able to stay in midwife care and need to transfer out to have access to physicians for a different acuity of care. In the collaborative model, though, you can still stay under the midwife care with physician directions. I know some of you came in as my GYN patient or Dr. Marrow, Dr. Mooney's GYN patient, and you're saying, oh, okay, well, I'll just go right over into the physician side of it. There's no physician side of delivery here unless it's complicated. So to that end, the majority of our vaginal deliveries are attended by our certified nurse midwives because they are the experts in normal physiologic labor and care of the normal newborn. If things become outside the scope of normal laboring, they know how to call us. So urgent consultations with us, myself, Dr. Merrill, Dr. Mooney, we are always on backup call. One of us is always on backup call for our midwives. If there's a true emergency, like something cannot wait the 15 minutes it takes for one of us to get to the hospital, where we deliver is staffed with OB hospitalist group that's board certified OB-GYNs who are in-house 24 hours a day. Now, to put in perspective how often there are true emergencies, emergencies can even constitute something that's not bad, like you just come to the hospital and you're 10 centimeters and we actually just don't have time to get to the hospital. We did over 540 deliveries in 2022. Only 2 of them did we need the hospitalist for actual delivery. So your chances of a delivery with someone who's not full circle are very, very low. Great. Where do we deliver? Excellent question. We are now at HCA Florida Hospital, which was formerly known as Memorial. It was also formerly some place where people weren't sure about birth. But when I tell you, if you're social, follow our Instagram page, and we have nothing but beautiful stories about full circle births at HCA Florida here recently. It's very close to our hospital. They're actually, excuse me, to our office. They're actually doing tours. So you can go to one of their stork tours that they have quarterly. I believe there's one coming up this month. So when you come in for your visits, you'll see it posted on the wall in the exam rooms. But if you're not able to make one of those, which are actually really cute, they're like baby showers, you get food and they raffle off prizes. You can win a pack and play. It's kind of cool. But they also have one-to-one tours available. So if you can't make the store tour, just get the phone number from us, and they do them during the day. They do them in the evenings so that your partner or family can come along, and they do them on the weekends. They're very accommodating, and our patients have been very, very happy there since we moved in October. Now, we are open on Monday through Thursday from 9 to 1. We close at 1 for lunch, so we're closed from 1 to 2, and then we open back up at 2 and we close again at 5. So if you call us between 1 and 2, you're going to get the after hours voicemail. The reason we set it up like this is if you have a medical situation between 1 and 2, that rings to the on-call provider. So please do not leave her messages about needing to change your appointment or pick up some forms or any of that stuff because she can't address that between 1 and 2. Just give us a call back when the office reopens. But don't also people call and say your phones are broken, but they called at 1:30. It's not broken, it's giving you access to the after hours person. On Friday, we are open from 9 to 1. So if you're calling with an administrative issue at 12:53, just know you may not get a response until we reopen on Monday, unless it's a holiday, or Tuesday. Um, we also, for your appointments, oops, there's a question here already. Oh, okay. You have what medications can you take safely? Hang on to that question because I'm going to address that a little later on. All right, we don't have walk-in appointments here because our goal is to see you as close to your appointment time as possible. And we can't do that if we promise somebody the 3:40 spot and you walk in at 3:38 and say, I need that spot. So we have some limited same day appointments. Sometimes people deliver or cancel or what have you. So, or sometimes there's traffic. And if you're coming in, our front desk is really good about saying, oh, there is an appointment, 20 minutes later, if you can hang on, you missed your appointment. But if it's something urgent, like if you call us at 9 in the morning and you say, I need to be seen, and we look and we're like, we actually don't have any appointments today. If we think it's urgent, we're believing you. We're not saying you should come here and sit in our lobby and wait to be worked in somewhere. We think you might be needing to be seen at an urgent care facility or at the hospital. So it's not us saying we don't want to see you. It's us saying that what you have is too important to be sitting in our lobby, just waiting to get worked in someplace. When you call to speak to someone, the providers are not personally able to leave patient appointments to take phone calls because, again, our goal is seeing people at their appropriate appointment time. And we can't do that if I promised you the 2 o'clock spot and someone else calls. It makes it seem like their problem is more important than your visit, and it's not. But we do have a nurse here, Tony, who takes triage calls. Many of the same calls come in frequently, and so she knows how to triage some of them. If it's something above what she's used to, she also knows how to get in touch with the on-call provider to get you an answer. But you have to give her a little time to reach out to that person and get a response because that's also the person who's covering the hospital. Anytime you call, though, you have to leave a message in order to get a call back. Sometimes people will call and hang up and call and hang up and call and hang up and say, no one ever answers me. We don't check the caller ID and call back everyone who possibly pocket dialed their gynecologist that day. So please leave a message and please be sure you're leaving the message with the right person to get the right response. Please don't leave our biller messages about your mucus plug. It freaks him out and he can't help you with that anyway. Pregnancy administrative stuff. Tony, the nurse, as I mentioned before, she also does letters and forms. So if you have FMLA or short-term disability, Tony is your point of contact. Many of you have already heard from or reached out to Naisha, our OB coordinator. She's the one who sent you your lab slips. If you have prenatal labs already ordered, if you've already met with me for your history visit. She also does referrals, like if you need to see your high-risk doctor, or if you need something scheduled, like your delivery, induction, version, that sort of thing. And then many of you on the call, I believe, have already met with Renee Hall, our benefits coordinator. So if anything changes at any time during your pregnancy, someone unexpectedly goes to the hospital and you meet your deductible, please update us because we don't want to still be collecting on something that you've already met. So Renee Hall is your point of contact for that. After hours, there's always someone from our practice on call for our practice. So the emergency on-call provider is the person who's covering the hospital, so you only call her if you think you need to go to the hospital. Again, though, you must leave a voicemail because if you don't, the phone will not register that a call came through. And please follow the prompts to let her know what's going on with you so that she can answer your call most efficiently. All right. You can also contact us on the patient portal, but do remember that the patient portal has a response turnaround of 2 business days. Like as soon as you hit the send button, a little message pops up that says, please allow 48 hours or 2 business days to receive a response. We also, so things that you want to use the portal for are things that actually require an action before you come back for your visit. If it's a non-action item, like you're just wondering, can I take these vitamins or drink this tea? That's something that we might pass on to somebody because we're going to be seeing you pretty frequently. So we may pass it on to the person who's going to see you at your next visit, or we may respond, yep, good question, bring it in to your next visit. So this is more for things like I lost my lab slip. So if you need your lab slip again because you want to get your labs done before your next appointment, let us know. We can email you a new one. Or if you need to cancel your next appointment or even convert it to a virtual appointment. COVID was a great example because you needed to cancel your in-person visit to the office because you needed to make it because you didn't want to spread COVID to my staff. Thank you for that. Things not to send on the portal. So remember, 2 business day turnaround means please do not send me messages about high blood pressure, not feeling your baby move, heavy bleeding, because those things cannot wait for 2 business days. Those are emergent or urgent things that you need to be calling the emergency on-call provider for. Also, don't send blitz messages. So if you have a problem and you say, well, I don't know who's on call, so I'm just going to send the same message to all 10 of you. Please don't do that. We have someone right now who's very confused because she had a prescription sent to Walgreens and then she didn't tell somebody else she wanted to use Walmart and now she's very confused about what she should be doing and she has 5 people working on her problem at the same time, which isn't efficient for any of us. One message to one person, give her 2 business days to respond. If she does not, then you can feel free to reach out to another provider. Also, multiple messages to one provider. You can reply to the same message to keep it in the same thread. Don't start brand new messages to respond to each thing because after we've answered 50 messages in a day, it's hard to remember that yesterday, 2 messages ago, we said this to you. So please keep it in the same thread. Also, don't try to have a full appointment over the patient portal. I've had people attach studies and things and say, hey, can you read over this and let me know what your thoughts and the pros and cons of all this? That's an appointment. The portal, again, is just something that we've done after we see patients all day long, do all our charts, review all our labs. And the portal is something, if we can do something really quick to make your life easier before your next appointment, we're happy to do that. Otherwise, that's our family time. So please feel free to text yourself questions to bring into your next appointment or schedule an appointment. We're here and happy to review studies with you in person during our regular business hours. The patient portal is also where we release ultrasound reports unless there is something urgently abnormal. Our sonographers have been doing this for many years and they know what things should not walk out the door without a plan. So if there's something urgently abnormal found on your ultrasound, that is one of the times that we will break our appointment schedule and have someone come in and talk to you between her patients. Otherwise, the reports are generated by the sonographer, downloaded from the ultrasound machine, uploaded to our electronic medical record system, divided between the providers, and then released to you. So again, please give us 2 business days to receive your report, review it, and release it to the portal. Sometimes you'll see the sonographers typing away and you wonder, oh my gosh, is something wrong? And you go and send a patient portal message saying, what's on my ultrasound report? The answer is going to be, we're not sure yet because we don't have it, but we know it was something that was not urgently abnormal because we let you walk out the door. We won't let you do that if a plan needs to be made. If you know your anxiety is not going to allow you to wait 2 business days to find out what's on the portal, that's fine. Please be sure that you schedule an appointment with the provider the same day following your ultrasound, because then she'll be able to get a preliminary report from the sonographer and go over it with you on that same day. Guess who else has a portal? Quest. And the annoying thing about Quest Portal is that sometimes they send the results to you before they send them to us, or they send them to you and they never send them to us. And then you get the results and you look at them and you see all this red and it freaks you out. Just remember, red doesn't necessarily mean abnormal. The reference ranges that are used for Quest are for non-pregnant people. There are some physiologic changes of pregnancy that make things that would normally be out of range, normal for pregnancy. So give us a chance to receive the labs from Quest, review them, and release them to you on the portal. There are times I'll release labs to you and say, this one may say it's red, but it's pregnancy normal. There are other times that that I'll say, hey, we actually haven't even gotten those labs back. You don't need to send the labs to us. We're going to reach out to Quest and get the labs directly through them so that it sorts into your chart appropriately by the interface. So if you've had your Quest labs for over a week and you haven't heard from us, let us know. But if you get them and you haven't heard from us, it's only been a day or so, that's okay. We may not have gotten them yet. Any questions on how to reach out to us, how to use the portal, lab fear, lab anxiety, as I call it? All right, cool. Let's move on. All right, what to expect with your prenatal visits. One, please expect that you are going to forget every question that you had for the last 3 or 4 weeks that you haven't seen us. So start a text thread with yourself, label prenatal questions, and you can bring it to your visits, and then we can go over everything that you want to talk about. We want you to wear loose, comfortable clothing so we can access your belly. We're going to want to feel your tummy and listen to baby's heartbeat. We do a Doppler with every single visit, not an ultrasound, but we do listen to baby's heartbeat at every single visit. So we're going to need to get to that belly. Rompers are not the best idea because sometimes you have to pull the rompers all the way off and we have to give you a sheet to cover yourself and you're sitting in there and you're half naked and it's just wear a shirt that you can pull up, that's fine, or shorts that you can pull down a little bit, but just something so that we can get to that belly. We ask that you arrive about 5 minutes prior to your scheduled appointment time so you'll have enough time to check in and handle any business at the front desk. We are not routinely getting urine samples on everyone. American College of Obstetricians say we no longer need to do that. So you'll only need to leave a urine sample if it's indicated, like we're following your blood pressures and we're worried about protein in the urine, or we're following your blood sugars and we're worried about sugar in your urine, or you're recently treated for a urinary tract infection and we need to see whether there's a test of cure. So you'll know whether we need a urine sample from you. Other than that, we know you're pregnant, you've been drinking your water, it was a long drive here, and you need to go to the bathroom. So that's all right. If you get here early enough, you will be able to do that. The next question that I have here is I reached out about cough drops and the young lady told me to Google it. Well, I have information on what you can take during pregnancy, and she may have said look on our website instead of Googling it because we typically do not want people Googling things. If you're 10 minutes late for your visit, we'll still have time to check on you and your baby, but obviously that leaves us less time for your questions. If you're 20 minutes late, that's the entire appointment slot. And as I said, front desk is really good about recognizing when there are open slots very close to when you're there. If that next time works for you, please go ahead and take that appointment so we can give you your entire time. Otherwise, we'll reschedule to a time that's mutually available for both of us. What we don't want to do is get into pushing the schedule back when other people are able to show up on time because we want to be respectful of everyone's time, everyone's appointment time. All right. Diagnostic ultrasound visits. So a question I get a lot is when is my next ultrasound going to be? Because we're not doing them at every single visit. It's a great question. And you also want to know when you're able to bring your family. So diagnostic ultrasound appointments are separate from your prenatal visits. The way to know whether you have an ultrasound scheduled is to look in your portal and see if you have more than one appointment time. Also, is there a provider's name associated with your visit? So when Tina Test, my test patient who doesn't exist, it's not her HIPAA, logs into her appointment, logs into her portal, she clicks on appointments and it shows her that she has 2 appointments scheduled on the same day. So Tina's first appointment is with ultrasound. Ultrasound is not one of our providers' names. So Tina knows she has, that's right, an ultrasound scheduled. Her next appointment is with Dr. Yeckel. Dr. Yeckel is one of our providers. So Tina knows she's having an ultrasound at 9:20, so her family can come and join her for that time. And if they want to hang around and talk to Dr. Yeckel as well, she'll get preliminary results from her ultrasound with Dr. Yeckel. Otherwise, her family can take off and head to work or whatever their other responsibilities are for the day. Now, if you know you're supposed to be having an ultrasound scheduled, but you don't see it in your patient portal, let the front desk know. So when you're coming out of your visit and Lauren says, hey, you need to schedule an ultrasound, be sure you're walking out with more than one appointment time. You should always have another prenatal visit scheduled and an ultrasound. And remember, ultrasounds are discussed on the same day if there is something urgently abnormal. Otherwise, we will send the reports to you within 2 business days. And the next question I have is there a childbirth prep class available? Yes, it's coming up later. And the next question, during my initial appointment, I was offered NIPT through Natera. Do you offer alternative companies to test through? If you find a different company through which you want to get it ordered, just let us know and we can order it through the different company. But that's the one that we usually use because they have more transparent pricing. Boutique ultrasounds. So as I mentioned, we're not doing ultrasounds at every single visit. So if you want to see your baby more than medicine says that it has a diagnosis, there are places in town that will look at your baby whenever you want to. These are just a couple for informational purposes, not endorsing anyone over the other, just tried to spread them out across the city. And I know there is one in St. Augustine too, at least one. I think there's one on the west side too. I don't think I have the west side on here. All right, so now it's time for a poll question. I know you guys are engaged because you're already asking lots of questions. So when should you expect routine ultrasounds? And the key word here is routine. Are you getting them at every visit, which I know is a bit, or are we doing them at 20 and 40 if you go past your due date? Or do we only do ultrasounds if you have a problem? And the polls are closing in 3, 2, 1. That's right. You are getting ultrasounds at 20 and 40 weeks. So 20 is your anatomy ultrasound. And if everything is routine, like we see everything we need to see, then you don't need to get any more until you go past your due date to make sure it's still safe to stay pregnant. If you have a problem, like we don't see everything at that first 20-week ultrasound, then you might have more, but those aren't routine. Routine would just be your anatomy ultrasound and then your post due date ultrasound. All right. All right, I think we're heading over to the website now. So this is fullcirclejacks.com. This is our website. This is not Google. So if we are asking you to look at medications that are safe for pregnancy, this is where we're telling you to go. As I mentioned, we are now at HCA. And if you missed the town hall we held in October about why we changed, and like I said, it's been a good change. We've done hundreds of births there now, and it's been amazing. You can click there and watch the event and get all those questions answered. So we're going to start with the providers here because one of these wonderful ladies will get the absolute pleasure of helping you grow your family. There's me, and there's my partner, Dr. Miro, my other partner, Dr. Yeckel, and Dr. Mooney. Then we have midwives, Lauren, midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. So as I mentioned, the midwives take first call for normal vaginal deliveries, and if there is a complication, they will call in some of the physicians. One of the physicians, whoever is on call for us. Now over here under patient information. So when we tell you to look for info, patient information, you're going to click the obstetrics tab. And that's where you'll see all the bellies and the baby at the end. So you'll know you're in the right place. And the question here is the 20 and 40 week ultrasound industry standard, or is that just full circle? Not sure I understand the question. So industry standard, meaning American College of Obstetricians and Gynecologists, yes. Whether that's what other practices do, I'm not sure because I've only worked at Full Circle. But those are the recommendations by our college, is that you check the anatomy when you're able to see all the parts. If we do them earlier than that, a lot of times you don't get all the cardiac views. But you want to do them in case you need some sort of intervention, if there's some sort of growth issue, or you need to consult with pediatric specialists prior to viability. Our delivery statistics are why many of you are here. And so we have those there dating back to 2018 regarding our C-section rates and things of those natures. Prenatal care timeline, this is what to expect at each of your visits. So everyone on this call has already had your 8 to 10 week confirmation. And at that visit, you also met with Renee, our benefits coordinator. And then your next visit will be virtual with me. Some of you have already had it, I know. That's your history visit where we go over your medical history. If you have a pregnancy history, we go over that as well and find out if there are any risk factors that affect how we care for you. At that time is when we order your regular prenatal labs. So we have lab transparency here. You'll know exactly what we're ordering each time because it's listed right here. These are the standard. This is industry standard if you are were wondering. So this is what the American College of Obstetricians recommends in terms of prenatal screening. So these labs will be ordered with your regular prenatal. You then have the option of opting in or out of genetic testing. So non-invasive prenatal testing is the last question asked. We don't have a specific carrier on here, so if there's somebody that you want to order them from, just let us know. Otherwise, our usual is Natera because of the customer service and transparency in pricing. Genetic carrier screening is also optional, as well as first trimester screening, which is that nuchal translucency ultrasound done between 12 and 13 weeks. For those who have high risk issues, we're usually sending your referral to maternal fetal medicine after you see me as well. At this point in pregnancy, we're seeing you in the office every 4 weeks. So about 4 weeks after your confirmation visit, you'll be coming back for an OB physical exam. And the physical exam is just like it sounds: heart, lungs, breast exam, pelvic exam. Since we're doing a pelvic exam, you have the option of having a pap test done at that time if it's due. But if you don't want to have the pap test done, that one's not part of the prenatal panel, just the cervical cultures that go with the standard prenatal blood work. And then about 4 weeks later, you're coming back in for your second trimester visit. And at that time, we just talk about normal second trimester changes. If you are doing the quad screen, which is the older genetic testing, this is when we order it. It has to be done before the end of your 22nd week. And then we see you back about 4 weeks later when we do your anatomy ultrasound. So you'll see in these other kind of side boxes too. So I don't think we're quite at the group that is in flu vaccine range, so that probably won't affect you. But we do screen everyone with the EPDS, the Edinburgh Depression Scale, and select patients with the GAD-7 for anxiety. We don't just screen for postpartum anxiety. We want to identify early patients who are at risk for developing those. And so don't think that we've singled you out because of something that we found. This is something that we do for everybody because that's part of a holistic practice, is taking care of the whole person, because pregnancy comes with a lot of emotional ups and downs. If you're meeting with one of the midwives after your ultrasound, she'll likely start talking about childbirth education classes and or breastfeeding classes, and I'll give you some resources for those in just a moment. About 4 weeks later, you're going to come back and we will order your glucose test. I know you'll have some questions about that. Don't worry, I have an entire spiel on glucose in just a moment. We repeat your blood count because some people have signs that they're going to become anemic in second trimester. My mom's with a certain blood type, if you're Rh negative, we make sure that your RhoGAM is available for you to give between 28 and 30 weeks. Around this time, we give you the information to pre-register at HCA. So HCA has digital registration, so there's no more packet that you have to fill out on paper and mail back in. And then you can schedule a tour with the hospital if you haven't already done one of the store visits, and be sure that your doula is locked in. And we'll talk about doulas in just a moment. As we're scrolling to the second page, I'm going to take a look at the next thing here. I had a visit at 8 weeks, but didn't get any blood work. I opted in for NIPT and carrier testing. If the visit with 8 weeks wasn't with me, then because I'm the one who orders it, and I think I had a visit with you. The blood work is not done on site. We don't do blood work here. So after your visit with me, you'll typically get an email from our OB coordinator that has the site of where you're going to be doing your blood work. And the next question is, I was told by one of the midwives is ultrasounds are every 4 weeks until 28 weeks, then every 2 weeks until 35 and 36. No, visits are every 4 weeks until 28 weeks, then every 2 weeks until 35 and 36, and then weekly until delivery. But as I mentioned, you're not getting ultrasounds with every visit. So that's actually perfectly right in line with what I was just saying. So the last one that we were looking at was 24 to 28 weeks. And so then you see here at the 30-week mark, the last thing over there on that third column says start appointments every 2 weeks. So at the 30-week mark, thank you, host, you start your every 2-week visits. My patients who have developed any issues with their pregnancy, like high blood pressure or high blood sugars, may have more frequent visits because they'll need antenatal testing. So they may be coming in more for ultrasounds, but not routinely. So we continue the every 2-week visits until 36 weeks, where you'll see over here on the right side, my host will highlight, you start your weekly appointments. For my moms who are anticipating having a belly birth, um, we try to get you scheduled. We try to get a date for you when you're around 33 weeks. The books at the hospital open up for scheduling about 2 months early. So that's the earliest we can get a date for you because usually my belly birth moms get off the train around 39 weeks. Um, Everyone comes in around 36 weeks, and we do another pelvic exam screen for group beta strep. We'll explain what that is and why it's important at that time. If you have declined to repeat your STD screening in the third trimester, because that's not necessarily an ACOG recommendation, but Duval County Health Department, then you're repeating cervical cultures again. So at the point that we start your weekly appointments, you're going to bring in your birth plan and prepare it for discussion because now you're full term. Congratulations. And you'll start the natural cervical ripening methods I'll go over in a little bit. As I mentioned, belly births are usually around 39 weeks unless there's special circumstances. And then when you go past your due date, we start the post dates testing, which is the additional ultrasounds that I mentioned. And we want everyone out by 42 weeks. So first time moms, if you need an induction scheduled, it's 41 weeks and 5 days. My veteran mommies, 41 weeks and 6 days because your labors tend to be half as long. The question I have is how often is blood work done? And you'll see on here that initially the blood work is given when you see me for your initial visit. This is the standard prenatal blood work here done at the beginning. The next time that you see blood work is around 24 to 28 weeks if you opt out of the other genetic testing. And then you see you have the option of repeating blood work again on the second page, and that's blood work as well. So you can see that that is how often blood work is done. All right, let's go back to the website. And the next box we're going to open up is pregnancy safe medications. So the question that I had out there, is it safe to take? What can I take? If you have a headache during pregnancy, just out of curiosity, are you more likely to meditate? Are you more likely to take a Tylenol, medicate? Or are you more likely to evacuate, leave your house and go to the emergency room because, oh no, I've never had a headache? All right, polls are closing in 3, 2, 1. All right, most people will take a Tylenol. All right, zero judgment here. On some days I have crowds that are more granola than others. All right, so those who are wondering what can you take, here you go. Safe medications in pregnancy. So I have them listed over on the left side, the discomforts and common discomforts and symptoms in pregnancy. Relief measures are in the center for those who are trying to avoid medication first, and then medication on the right side. So things like cough and cold and congestion, all of these things are here in the middle. And then if what's working in the middle doesn't work for you, please go to the things on the right side. If what's on the right side still isn't working, then please reach out to one of us, because I promise, like the first time people send me a message and say, oh my gosh, what can I take for constipation? First question I'm going to ask is, have you taken everything on our website? And so people are starting to get slick now. All right, Dr. Adams, I've taken everything on the website. I've tried everything. It got a little bit better, but I still need some help. So you'll also see some warnings on here, things we want you to avoid, ingredients that we want you to avoid, like pseudoephedrine, Pepto-Bismol, and then some caveats regarding some of the symptoms. If you've been nauseous, vomiting, can't keep anything down for more than 24 hours, don't keep trying things. Please call us because you probably need to go to the hospital for that. Next question I have is, I have had my first appointment, got HCG testing done, but haven't had regular prenatal blood testing. Is that right? Or should I have gotten that slip? Or is that part of when I get genetic testing? So was that appointment with me? Because when you do your virtual appointment with me, that's when I order labs. And the labs come to you in an email, usually within about 1 business day after we've had our consultation virtually. If the appointment wasn't with me, then no, you haven't had your labs yet, because I haven't taken a history to figure out which labs we would want on you in addition to prenatal labs. And the next question is, for cough drops, it just says throat lozenges. Are Halls with menthol safe? Yes, because those are throat lozenges. Absolutely. There's no type of throat lozenge that you say that we say that you need to avoid. That's why we kept it generic. We didn't use specific brands because there's lots of brands out there. So be sure to print this out or download it to your phone. because it sounds like this group might need some of these things very soon. But it's also out here on our website for you at all times that you can take a look. The next box here is a gestational diabetes screening test. We're not going to click on this box, but I will refer back to it. So just remember, this is out here on the website with lots of good information that you will need around 23, 24 weeks. Weight gain in pregnancy is another common question because some people are worried they're not gaining enough. Some are worried they're gaining too much. How much you should be gaining is based upon what your starting body mass index was. So there's a link on here for National Institutes of Health. You can put in your height and your pre-pregnancy weight. It'll give you what your body mass index is, and based on that, it's how much weight it's recommended that you gain in pregnancy. If you have twins, you can add 10 pounds to the upper number for the range that's on here. And if you'll notice in that third column, the rates of weight gain are in the second and third trimester per week. So if you're in your first trimester and you're nauseous or food just doesn't sound good and you have a bunch of aversions and you haven't gained any weight, don't worry. All of this weight gain, as I mentioned, is usually calculated in your second and third trimester. Now, if you gained weight in your first trimester, that's also okay, but just don't worry if you have not. As long as you're making healthy choices and staying active, your body will do what it needs to do to support a healthy pregnancy. All right, so just remember that this is out here as well. Birth preferences. So many of you have asked about making birth plans. So obviously this isn't something you need today, but you're going to be bringing this in when you are full term. And for my first time moms, there's sometimes a lot, I mean, you've never done this before. So you have a lot of anxiety about what happens at the hospital and what things do I expect. And sometimes writing down things that you would prefer if everything is going well kind of helps to ease some of that anxiety. So this covers everything from how you want labor to start, like do you want to wait as long as possible? What you want to wear in labor, what you want to do for pain relief. Obviously, it's a hospital. They have epidurals, they have IV pain medicine, but we also have tubs, and water labor can help a lot with the discomfort associated with contractions. There's also nitrous oxide, the gas, like at the dentist's office, to help with the top of the contractions or surges. Other things just to highlight on here is that we are not strapping you to the bed and starving you. Like our goal is for you to be hydrated. Our goal is for you to be active. We want you and baby to be active participants in labor as well. So you can labor in any position, you can push in any position, you can deliver in any position. It's fine. Our standard is usually perineal massages and warm compresses to help to prevent tearing. It's pretty rare that any episiotomies are ever cut. I probably remember about 6 in my 20+ year career. Immediate skin to skin, delayed cord clamping, all of those things are full circle standards. If you want anything different, like if you're planning cord blood banking, let us know and we'll, talk through that on an individual basis. The medications that are routinely offered to newborns are listed on here. You also always have the opportunity to bring this in and ask the midwife, well, what is this medication for? Does this apply to me? Do I need this? Just kind of talk through it and find out what makes sense to you. For my moms with twins, we also do dimmed lights, and you have options for pain control as well. And for my belly birth mamas, gentle cesarean is a phrase that we've coined around here because we do family-centered birth. It is still a birth. It's a belly birth is what we call it. And so there are a lot of options regarding that as well. So feel free to talk to one of the providers at your visit about that. So it may look a bit daunting. It's 21 boxes. All 21 probably won't apply to you. Most people on this call have at least 21 weeks of pregnancy left. So if you just take one box per week and talk yourself through it, everything on here is a matter of opinion and preference. There's nothing dangerous on here. So whatever you choose that's salient to you is fine. And you can bring it in and we'll chat about it around 37 weeks. All right, back to the presentation. Thank you. Cervical ripening techniques. So remember, this is out here as well. Do not Google this because you will find things like castor oil, which you will not find on my list. But things you can start as early as 20 weeks. Raspberry leaf tea can help to tone the uterus, which makes your contractions more efficient. You'll also see things like acupuncture, acupressure, evening primrose oil, clary sage dates, all of that. Week by week, you can just see the things that we recommend. These things don't put you into labor, but when baby gives the signal for labor to start, they help to make your cervix more receptive to the contractions so that it can dilate smoothly. So just remember this is out here, and remember castor oil is not on this list. And if you want to know why, you can ask any of the midwives at one of your prenatal visits. Question I have here is, can I exercise during pregnancy? It starts talking about kickboxing, and I'm actually going to talk about exercise in just a moment. So hang on to that question as well. The next question is about having a miscarriage and anxiety if we're not seeing you but once a month. Remember the boutique ultrasound places? The boutique ultrasound places will do ultrasounds if you're not sure about what's going on with the pregnancy. Um, at least until you can feel baby move is what I sometimes suggest to people if you need to be seen more frequently. Normally, you start feeling baby move at about 18 weeks, and so by that time, you start to feel a little bit better. The next question is what level NICU? It's a level 2 NICU, as I think the only level ones left in the city are Beaches and South because they funnel most things downtown. The only level 3s that are left are Baptist Downtown because there's Wolfson's and UF Health. So it's a level 2, like most of the other hospitals in the city. Good question. First time moms and trial of labor after C-section moms. Do I have anybody who had a C-section before and is going for vaginal birth after cesarean? If so, all right, there are only two answers. So I know all my first time moms, it's a no. And then I have some people who say yes, and they're going to rock it. And the polls are closing in 3, 2, 1, done. All right, cool. So then we will talk as though we have both on the line. So first time mamas and mamas who had a C-section before, your goal is the same. You're trying to avoid that next C-section. And so these are some recommendations that we have because you want to feel like you've done everything you can on your end because babies are gonna baby. They're gonna do whatever babies do. You can't control that, but control what you can. These are ways to reduce conversion to cesarean because I will say the most common reason we are doing C-sections these days are not babies too big or babies in distress. It is babies in a wrong position and won't descend into the pelvis. So most of these things are centered on changing your body to adjust baby's position within your pelvis. So just take a look at all of these things. And I will say avoiding non-medical induction before 41 weeks, especially for my first time mamas, because y'all get really impatient. You just want to see that baby. And you start asking us, how can we get them out? So trust us, we have the same goal that you do. We don't want our C-section rates rising because we're doing unnecessary interventions on people. So everybody take a look at this. This is for everybody on here. All right, we'll go back to the last thing on here. If you have a little guy and you want to have him circumcised, we don't do those in the hospital because they're brand new. They need to learn breastfeeding and all that other stuff. But we do them in the office up to 10 days of age. So usually how that happens is once your son is born, we ask whether you want to have him circumcised. And if you say yes, we let our OB coordinator know, and she will send you a portal message with his appointment date and time. If it works for you, fantastic. If not, just communicate back with her and she'll get you straight. All right, fullcirclejacks.com. That's where all that information is. So don't forget that is out here. And now we're going to go back to the presentation where I believe we start talking about nutrition. All right, so the first thing that I think you'll see on there is one of my favorite drinks that I actually stopped drinking after I made this presentation because I realized it was more than a third of my calories for the day. The question I have here is, do you recommend the RSV vaccination? And I am actually going to talk about that a little later on in the presentation as well. The short answer is yes. So those who are concerned about early weight gain, but Dr. Adams, all I'm doing is drinking coffee in the morning. I barely eat anything. Now, are you drinking coffee or are you drinking one of these mocha monstrosities? Did you know that pregnancy only requires an additional 300 calories per day, which is not a lot? It's not eating for two by a long shot. It takes 10 kilocalories to maintain a pound. And remember, your goal body weight is based on what your starting body mass index was. So if you're starting your pregnancy at 170 pounds, then it takes 1,700 calories to maintain that. If your goal is to gain 25 pounds by the end of pregnancy, that's an additional 250 calories for a total net daily caloric intake of 1950. Now, if you're doing something amazing and burning 500 calories a day, obviously, yes, you're fine. But if you're not, then 1950 is what your net caloric intake. You divide that by breakfast, lunch, and dinner, that's 650 calories per meal. Now, if you eat that 650 calories, fantastic, but then don't wash it down with 570 more mocha monstrosity calories because your baby does not know the difference. Your baby's going to take his or her or their 300 calories off, and the rest you get to keep. Mother's Day is coming up. That is not the present you want. The question I have is, we're allowed to drink coffee? Yeah, I'm going to talk about that in just a minute too. See, people have the same questions over and over again, which is why I already have the answers to everything y'all are asking in this presentation. It's like I've done this before. All right, this is a very busy slide, but the bottom line is just turning your food over and making good decisions. I highlighted a couple of things here, especially sodium. You can make very easy substitutions here, and avoid about 500 milligrams of sodium by just choosing a different spaghetti sauce. Watching the fat and the carbohydrates in your food as well. And then just remember, this busy slide is out here, so you can always just take a look and see, am I eating the right amount of carbohydrates? Am I limiting my fats appropriately and all that good stuff? So, what kinds of things can you eat? Thought you'd never ask. Fruits and veggies, whole grains, cereal. You will not give your baby a nut allergy or a dairy sensitivity if you eat those things during pregnancy. Those are genetic and not environmental. And if you're going to pass it to your baby, you're going to do it either way. So, enjoy your nuts and dairy. Caffeine, to answer your question about coffee, yes, you can, as long as you keep your caffeine under a total of 200 milligrams daily. Now, that's the advice by the American Pregnancy Association that's generally accepted. Do keep in mind, though, if we've identified a reason to limit something, that means it may have a bad outcome or bad effect. Too much caffeine toward the end of pregnancy can cause irregular heartbeats in babies, and that's usually the first thing we say, are you drinking coffee? If we hear baby's irregular heartbeat. So if you can go less than 200 milligrams, fantastic, but just know overall, there are no issues with you drinking caffeinated beverages. Herbal teas are fine. Our favorites for pregnancy, as I mentioned, raspberry leaf before, but also ginger helps with nausea. Lemon and peppermint help with fatigue and or insomnia, because pregnancy is both things, which is wild. For my vegetarians, you want to make sure that you are still getting 70 grams of protein a day. For my bodybuilders and weightlifters, you don't need to have more than 70 grams of protein per day. I know there are some diets out there that have you cramming 100 and 120 grams of protein. That is a lot of protein, and you're going to grow a 10-pound baby. So 70 grams is your sweet spot. Please just keep it right around there to keep from not having an underweight baby or an oversized baby. Deli meat, yes, you can. There's been a big recall on deli meat recently. So if you bought deli meat from one of those places, please double check, because a lot of it was recalled. But in general, deli meat is fine as long as you microwave it for at least 30 seconds to make sure that any bacteria is out of it. It does not have to be piping hot, fresh out of the microwave. Like, don't burn your mouth, but just microwave it for 30 seconds. For soft cheeses, as long as they're made with pasteurized milk, you're okay. So if you're buying it from Trader Joe's or Publix, just flip it over and you'll be able to see that. If it's not made with pasteurized milk or you can't tell, then you may want to just avoid it until after pregnancy. Canned tuna, you can have up to 3 4-ounce cans per week. If you are a pescatarian and you need more fish than that, here is a very nice document from the FDA, which gives you lots of information and it was updated actually even more recently than 2021, I believe, but tells you about fish that you should eat in larger quantities because they're high in omega-3s, which is good for baby's brain development. Fish you should eat in moderation, and which ones you should avoid altogether because of things like methylmercury. It's a long document. So I won't go through it, but just know that it's out there, and this presentation will be on our YouTube. For the deli meat, is pan cooking it the same thing as 30 seconds in the microwave. As long as you do 30 seconds of high heat, that is fine. Pan cooking, okay. Haven't pan cooked meat. Is that spam or something? No, never mind. Things you want to avoid, undercooked meats. So that yummy ahi tuna, it's so good. Sorry. You can have that after you're not pregnant. If you are a foodie like me and you like your steaks medium rare, you will need to ruin your steaks and make them well done for the next 6 months. I apologize in advance. For my kombucha drinkers, my kimchi eaters, those are fermented foods and beverages, and the jury is out on how much of that is okay. So just keep it in mind. We don't recommend it. Same with alcohol. We know fetal alcohol syndrome is a thing. We don't know how much causes it. It may be different in different people, so we don't recommend alcohol during pregnancy at all. Over 1,500 milligrams of sodium is also not recommended. When you start flipping your food over or looking at nutrition facts in your favorite restaurant and finding out how much sodium is in your food, you will be appalled that 1,500 milligrams is your limit. So when y'all send me messages, Dr. Adams, I can't get my ring on anymore. First thing I ask is, what you have for dinner last night? And then y'all close my message and you don't answer. I know what you had last night. Don't eat that. Any questions about food before we move on to exercise? Okay. Exercise. I know I had an exercise question. So it is just fine to continue most of your pre-pregnancy activities unless your pre-pregnancy activity was doing nothing, binge watching Netflix. Don't do that. That's not an activity for you. You just won't feel like it very much in your first trimester. Everyone's tired. You all get a pass in first trimester. I will revoke that pass at the 14-week mark because in second trimester, you'll get some physiologic changes that will increase your blood volume by 50%, which increases your oxygen tension and saturation, and you'll be able to do more aerobic exercises without feeling winded when you walk across a room. So if you are not performing at the Olympian level that you were before, don't kill yourself. It's fine. You're going to get back to it. You'll be fine. Just listen to your body. If you weren't doing anything before, it's okay to start a new regimen because, again, I cannot stress this enough. Sedentary lifestyle, pelvis tilted backward, leads to malpositioned babies, which leads to more intervention and cesareans. For those of you with these cute little Fitbit watches that probably add to your anxiety about what your heart is doing at 3 in the morning, if you notice that your resting heart rate has gone up by 10 to 20 beats per minute, that is a normal physiologic change of pregnancy. Do not freak out. If you're not getting dizzy or lightheaded with it, it is okay, and that is normal. That's what your body's supposed to be doing during pregnancy. So, what exercises can you do? Those of you who are saying, actually, I walk a lot and that's my exercise. Is it? So walking can be considered exercise if when you walk, your heart is in the aerobic zone. Your heart rate's in the aerobic zone, which is 70% of your max heart rate. And the max heart rate is calculated according to your age. So we start with 220. If you're 30 years old, you subtract 30 from 220, and 190 is your max heart rate. So you should not be exercising for prolonged periods of time with a heart rate above 190. 70% of that, though, is where your aerobic zone begins. That's where you actually begin to use your oxygen for energy. So if when you're walking, your heart rate is between 133 and 190, sustained for 30 minutes, 3 times a week, then walking is your exercise. If when you are walking, your heart rate is still chilling in the 80s or 90s, then walking is your transportation and you can find another form of exercise. What types of exercise can I do? If you like the treadmill, go for it. Elliptical, yes. Running, sure. Swimming, my favorite, actually. This is my summer cruise. So y'all have the opportunity to take advantage of swimming. Makes your belly weightless and your joints feel amazing. It's really good cardio. Indoor bikes, if you have a Peloton, I am on the leaderboard and off my meds 8. If you follow me, I follow back. We can do workouts together, keep each other honest. Weightlifting, if you were lifting prior to pregnancy, you can continue to lift whatever you were lifting right before. You don't need to increase your resistance during pregnancy as your baby and your body will do those. If you are squatting, I love squats. Ina May Gaskin says do 100 squats a day. I'm going to set the bar a little lower. If you build up to 50 squats a day, it is better than none. If you're already squatting and doing more than 50, go for it. If you haven't been squatting, start at 20 weeks with 5 per day. At 21 weeks, give me 10 a day. 22 weeks, give me 15 a day. And your 50 doesn't have to be all at once. You can do 25 in the morning, 25 in the evening. You can also do Pilates and yoga, anything long and lean, stretching out those muscles, stretching out the ligaments and opening up that pelvis. And any experienced instructor will be able to tell you what the pregnancy modifications are for Pilates and yoga. The next question I have is, can you sleep on your back or only on your side? And believe it or not, I actually have that question answered coming up soon. So I'm just going to cliffhanger you. High intensity interval exercises after your first trimester. It's not the intervals, it's the intensity. So you can still do the low impact versions of these, but you just don't want to be doing things with sudden jerking movements because after first trimester, you can shear the placenta and create subchorionic bleeding. Lying flat on your back for exercise like excessive ab work. You can do standing abs, you can do side lying abs, but just not lying on your back for aerobic exercise. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, it does tend to make you dizzy and you start to pass out. Scuba for the same reason, the change in bariatric pressure, decreasing oxygen to the baby. Same thing for high altitude hiking. If you need to visit family at high altitudes, like you have family in Colorado, you can visit them, just don't go hiking while with them on your visit. Contact sports. I had a question about kickboxing before. We would like for you to not kickbox during pregnancy. And it's not the time to start kickboxing either. So something that does not involve people's feet flying at your belly, please, during pregnancy. Outdoor biking after 16 weeks is with an asterisk because it's not a contraindication. It's just keep in mind 16 weeks is when your center of gravity starts to change, and when you start to turn corners on the bicycle, sometimes you will fall over, and we don't want you falling off of your bike and especially onto your belly. I feel like there may be more exercise questions. So while this poll is up, start thinking of those and you can add them in too. Now that we've talked about nutrition and exercise, can you prevent gestational diabetes with diet and exercise? And the key word here is prevent. And my veteran mamas already know what the answer is here. But I'm gonna give everybody a chance to respond, and polls close in 3, 2, 1. Done. All right. The answer is no. You cannot prevent gestational diabetes with diet and exercise. You can manage it. It can be part of the management strategy, but it does not prevent it. So, just the diagnosis of gestational diabetes is not a judgment on your lifestyle, on what you eat. The reason that we screen everyone for gestational diabetes is because of one thing: your hormones. And those hormones come from your placenta. That is your number one risk factor for gestational diabetes. The placenta gives off hormones in increasing amounts after 24 weeks that tell your insulin not to do its job. The insulin's job is to clear your system of glucose so your body uses it for energy. If the insulin is not doing its job, you have extra glucose circulating in your system, which is the definition of diabetes, extra glucose. But it's extra glucose because of your placenta. So it's gestational diabetes, which is very different from diabetes because of family history or overweight or all those other things. So if you don't have a placenta, then I will not screen you for gestational diabetes. But if you do have a placenta, then we are going to want to screen you for gestational diabetes. So my moms who say, but I never eat anything with sugar, don't avoid carbohydrates prior to the test. You eat fruits, you eat whole grains, you can continue with your healthy carbs because you don't want to avoid carbohydrates and then do the glucose screen. If it's the actual drink that they use for the glucose screening, we got you covered on that as well. We have some patient-friendly options. Remember that box that we didn't click on the Full Circle Jack's website? It has the full instructions on what to eat before it, all of that good stuff, but it also has these different options. So we have for sale at our office the Simply Pure drink, which is soy-free, it is dye-free, it is gluten-free, it is BBO-free, it's kosher, it's vegan, it's offensive to almost no one. If Simply Pure for some reason does not work for you, there's also the Fresh Test, there's Glucorganics, and there are glucose tabs that are available as well. And all those, as I mentioned, are listed on our Full Circle Jacks website with links to those. If you're going to be doing one of these tests, please notify the ordering provider because Quest does not accept outside drinks. We'll need to send you to LabCorp. Also, there are instructions on not opening it before you get there. Don't drink it before you get there. And we need to write on your lab slip that you're going to be bringing your own outside beverage. So please let us know if you don't plan to take the drink that they offer at the lab. And I'm not sure. Oh, okay. The question I have, it's person to a bag, not person to person. Okay, yeah, if you're just kicking your leg and no one's kicking at you, then kickboxing is fine. The next question is benefits of breastfeeding, and that's a question for your visit because it's not a short one because there are many, so many. It's a great visit. Ask any of the midwives. You'll be hard to get them to be quiet about the benefits of breastfeeding. My goodness. All right. Other things to prepare for birth, childbirth education classes. I had this question earlier. So for those who are going for unmedicated deliveries or just delaying pain medicine, maybe looking at method classes. So there are methods like hypnobirthing, hypnobabies, Lamaze, Bradley method. And for partners, supporting her. You need a class too. So supporting her is really good for teaching you what not to say so you don't get bitten or yelled at during labor. But these other things, again, are for informational purposes. We're not endorsing anyone over the other. But these are childbirth education classes that actually help you with preparing for labor. And so this is a good jumping off point for finding what's out there in Jacksonville. Breastfeeding classes, we can also connect you with La Leche League as they have breastfeeding classes as well. CPR classes for parents. Every new parent should know CPR. Even if you already know adult CPR, it's not the same. You're not just doing it with one finger because the baby's smaller. There are bigger differences with CPR. So here's a link to Red Cross for taking a class for CPR. If you're already seeing a chiropractor, fantastic. Make sure he or she is Webster certified, which is a special pregnancy certification to help with the adjustments due to the changes of your body with pregnancy. All right. How many of you are planning on working with a doula? Question out there in the poll. If you are, and some of you I talked to, like I was impressed. You were 10 weeks. You're like, I've already selected my doula. I know who my pediatrician is. I'm very impressed. All right, polls are closing. Three, two, one, boom. Okay, cool. More people than not. That makes my heart happy. And some people are just not sure what a doula is. I'm so glad you asked. So doulas are there for emotional and physical support before, during, and after pregnancy. Some people say, well, why do I need a doula? I have a midwife, I have a doctor, I have nurses. What's a whole team? It's a whole team working on you. It's like you're going to the Oscars. So doulas are there to help you with breathing techniques, positional changes, relaxation strategies during labor. They are not per se part of your medical team. Like they're not giving you pregnancy advice in terms of what medications to take or when to be induced or that sort of thing. They are there to help advocate for you and support your birth choices and the things that are on your birth plan to try to help you get as much of the to retain as much of the autonomy as you want during your labor as you're safely able to. Doulas bring people to us because they like that they can support their clients and not have to argue with us about doing unnecessary interventions. The best doulas with whom we worked are ones who come to your house. They may come to a couple prenatal visits with you, but when your labor starts, they come to you and they do not leave your side until that baby is out and latched. And then you talk to them afterward too, to just kind of navigate the abyss that is the postpartum space as well. So remember, your doula is not going to deliver your baby. That's what you're paying us a nice amount to do that. So we will be there to do that for you. All right. Oh yeah, and if you have questions about who the midwives, again, have no shortage of recommendations and opinions about who the doulas are who have supported our patients very well through the years. Acupuncture, when you come out of the bathrooms at the front of the office, there are a lot of business cards on the wall. All of those are people who have worked with us and worked with our mamas before. Pregnancy massage is all right as well. Most places will not do it in your first trimester just because that's when your highest risk is for miscarriage anyway. And they don't want you to associate one thing with the other. Some places require a note. We do have a standard pregnancy massage note. So if you're planning on getting one, just message one of us and we can have our OB coordinator email that to you as well. Breast pumps. Many of your insurance companies cover breast pumps. We have a connection. We have a company that will look at your insurance, see what it covers, write the prescription, send it to us. Makes it really easy for both of us. So please don't go and find your own company to find a breast pump for you because when we get messages from those other kind of, I call them rogue companies, they ask all sorts of unnecessary questions and go back and forth and it takes you months to get them. This company that we found has been very easy, quick, tried and true. So around 20 weeks is a good time to scan the QR code that is in every exam room. You can scan that code and get your breast pump ordered. You'll have it in plenty of time for baby's arrival. All right, postpartum, because one day your pregnancy will end and the baby will be out. So anyone who had any issues with blood pressure, we'll see you we'll see you sooner in the office. Usually we see you about 1 week after you deliver to just make sure that your blood pressure is still okay. We're not developing any severe preeclampsia because preeclampsia can happen postpartum. actually up to 14 days postpartum. For my mamas who had belly births, we see you about 2 weeks after delivery. Usually, we routinely screen you with the EPDS as well postpartum. Postpartum doulas are a thing. And remember, if doulas are there for emotional and physical support, when do you need that more than after you have a baby? And then we have referrals to the motherhood space, which is an amazing new resource in Jacksonville for support and counseling for postpartum moms who are at risk or suffering from postpartum depression and anxiety, as well as pelvic floor therapy, which is standard of care in Europe because babies change things. And so pelvic floor, we have a nurse who comes in 3 times a week, and everyone who's 8 weeks and up, we try to schedule you for 8-week sessions to make sure that we're putting things back where we found them so that you're not leaking urine and feeling like everything's falling out after a baby comes out because, like I said, babies change things. All right, random frequently asked questions. This is one you just asked me. Yes, you can sleep on your left side. You can sleep on your right side. Yes, you can sleep on your back. Some people get dizzy when they sleep on their back. If that happens to you, you can always put a wedge pillow that you can get off of Amazon under one of your hips to keep you from being able to roll all the way over onto your back. You can help paint you can help paint the nursery as long as it's a well ventilated room. Open those windows, put on a mask. You can take probiotics during pregnancy. You can also dye your hair, which includes your eyebrows. You can get gel nails. If you're going to be in the salon with a lot of fumes and stuff, you might want to wear a mask when you're in there just to protect yourself from some of that, just getting lightheaded or dizzy. Car travel, think summer vacation. Yeah, y'all are my summer vacation crew. You traveling is fine up to 37 weeks by car. Just be sure you're getting out and stretching every 2 hours. If you're drinking the right amount of water, you will have to do that. After 37 weeks, I don't recommend going far away from us because you're full term. You want some stranger to deliver your baby. I sure don't. Skincare, you can use your benzoyl peroxide, your salicylic acid, just nothing that has retinol in it. So there is an alternative to retinol. It's called bakuchiol, Bakuchiol, and it's found in some naturally derived products. It has all the effects for the positive effects for your skin without harmful effects of retinol for the baby. And airplane travel, flying is okay for my twin moms up to 32 weeks, for my singleton moms up to 36 weeks, as long as you are, please, 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 wear your compression hose. And drinking a lot of water and doing your toe raises to exercise your calves and keep from getting blood clots in your legs, which could travel to your lungs. Things I would like for you to avoid, my summer crew, roller coasters and water slides. I was at Disney last week and I was side-eyeing pregnant women walking past rides. All right. Last thing is our COVID-19 update, and we will be done. So ACOG moved from supporting either way the vaccination to strongly recommending it based on the New England Journal of Medicine article in 2021 of over 35,000 vaccinated pregnant women. Manufacturers Moderna and Pfizer are fine. We don't recommend Johnson & Johnson because of its independent risk of blood clots, which pregnancy has as well. We don't want a double increase in that risk. Booster recommendations, all vaccines are approved for boosters. So if you're 6 months past the Moderna or Pfizer and would like to get a booster during pregnancy, it is fine. If you are 2 months past a Johnson & Johnson, you can get a booster, but not of Johnson & Johnson. You can get one of the other ones because mixing and matching is okay. There's no optimal time for it versus the flu vaccines or RSV or Tdap. But if you're looking to have your antibodies in time for baby to be able to pass passive immunity with breastfeeding, early 3rd trimester is your best time for all of these. If you do happen to contract COVID, please do not come to the office. I repeat, please do not come to my office. There are no formal recommendations for ivermectin, azithromycin, or Plaquenil, so we don't prescribe those. But the recommendations are for vitamin C, vitamin D3, and zinc in the doses that you see listed here. We also recommend a baby aspirin starting at the time that you contract COVID as long as it's before 36 weeks. If you get COVID after 36 weeks, do not start the baby aspirin then because it will increase your risk of bleeding at delivery. Because COVID has been associated with gestational hypertension or development of high blood pressure in pregnancy, baby aspirin has been shown to reduce that by 40%. And we also want to start following baby's growth to make sure that baby is still staying on track after exposure to the virus during your pregnancy. Question I have here is, what about giving the baby a bath? That is totally up to you. If you'd like for your baby to have an early bath, nurses are happy to do it. If you'd like for your baby not to have a bath, tell them you would prefer to delay it. If you can track COVID, recommended to just have supportive therapy at home. Again, the medications that are okay in pregnancy for cough, cold, congestion, sore throat are on our website. You only need to go to the hospital if you're having trouble breathing or you have a fever that you're not able to bring down with okay amounts of Tylenol in pregnancy. Lastly, we are back for my veteran moms who had your first baby during COVID. I'm sorry, it's much better now. It's safe out here again. We're back to our normal number of visitors. I know y'all are very traumatized by what your first delivery was like. It's going to be so much better because you can have 4 visitors again. Yay! Plus your certified doula. You do not, no one's wearing masks in the room. And we're only having people wear masks in labor if they are actually actively COVID positive at the time of delivery. Even if you have COVID during your labor or delivery, we're not separating you from your baby. We give you an isolette for baby to not be exposed to your respiratory droplets, and you're given N95 masks. All right, so last question, which I know you're all going to get right, is what information can you find on my website? And while you are answering that, the question I have is, are doulas allowed in belly births? Absolutely. It's encouraged to have a doula in for your belly birth because it helps so much with anxiety. All right, so the answer is the one that says FYI, this is the correct answer. You can find your birth template, safe medications in pregnancy, and what to expect at each visit on our website. Please remember, we are social, so follow us on all the things. You will see a series that we have called In Her Words, or Birth Becomes Her, where rock star mamas share their stories, and we know that you're going to have an amazing rock star birth as well. And so we invite you to share your story to inspire other moms behind you, because a lot of you came to us because of what you heard somebody else's birth was like. So when your birth is amazing, we want you to share it as well. Thank you guys for all your questions, for your participation. I love it when I'm not the only one who's bringing up stuff. Hopefully you will be able to go back and take a look at this again. I appreciate you, and I appreciate you for choosing Full Circle, and we'll look forward to seeing you guys in the office real soon. Bye.